There is a particular cruelty and suffering that has no name, no explanation, and no end in sight. Today, if you are in serious pain, you exist inside a system built around the assumption that pain should be reduced. Hospitals, anesthesia, morphine, surgical intervention. The entire infrastructure of modern medicine operates on the premise that human suffering is a problem to be solved. For most of human history, that premise did not exist. Pain was not a problem to be solved. It was a condition to be endured. And some of the diseases that moved through human populations before the 20th century produced suffering of a scale and character that is almost impossible to fully communicate to someone who has only ever experienced pain inside a world where relief is available. The question of which disease was the most painful is not a simple ranking. Different diseases produced different kinds of suffering. Some were acutely agonizing for a short period, some were chronically debilitating across years or decades, some destroyed the body in ways that were visible and horrifying, some destroyed the mind alongside the body. The honest answer is a list, not a single winner, but certain diseases stand apart from the others in ways that require acknowledgement. Rabies deserves to be mentioned first, not because it was the most common, but because of what it did to the mind. Rabies is caused by a virus that travels from the site of infection, almost always an animal bite, along the peripheral nerves toward the brain. The journey is slow. Weeks or months can pass between the bite and the onset of symptoms. During that time, the infected person feels fine. Then the virus reaches the brain and the horror begins. The early symptoms are anxiety, confusion, and a strange sensation around the original bite site. Then comes hydrophobia, a spasm of the throat muscles triggered by the sight or sound of water, or even by a breeze on the face. A person who is desperately thirsty cannot swallow water without triggering violent, agonizing throat spasms. The disease progresses to hallucinations, delirium, aggression, periods of terror alternating with periods of relative calm, seizures, paralysis, and then death, almost always within days of the first symptoms appearing. Before the development of the rabies vaccine in 1885, a bite from a rabid animal was a death sentence. The person who received it had weeks or months to contemplate their fate before the symptoms began, knowing what was coming, unable to stop it, watching the calendar. But for sheer physical agony sustained over time, rabies has competition. Kidney stones, technically not a disease but a condition, produced some of the most acutely intense pain ever recorded in medical literature. Physicians in the ancient world described kidney stone pain as exceeding the pain of childbirth, the pain of sword wounds, the pain of burns. Before modern surgical techniques, the only option for a large obstructing stone was to wait and hope it passed, or to undergo a procedure called lithotomy, the cutting of the stone from the bladder through an incision in the perineum, performed without anesthesia, with the mortality rate of the procedure itself being significant. Patients who survived described the pain of lithotomy as worse than the stone. Patients who survived the stone described the pain as the worst experience of their lives. This was not a rare condition. Kidney stones appear in Egyptian mummies. They appear throughout medical literature across every era and culture. Tetanus, known historically as lockjaw, produced suffering that observers consistently described as among the worst they had witnessed. The tetanus bacterium produces a toxin that blocks the nerve signals that allow muscles to relax. The result is sustained involuntary muscle contraction that begins in the jaw, making it impossible to open the mouth, and progressively spreads through the body. The back muscles contract so severely that the body arches backward into a position called tetanus, where only the head and heels touch the surface the patient is lying on. This position is maintained by sustained muscular force. The patient is conscious throughout much of the process. They can feel everything. The contractions are not brief spasms. They are sustained contractions that last for extended periods, producing pain that survivors and witnesses consistently described as beyond ordinary human experience. And the patient remains conscious, aware, unable to communicate effectively because the jaw is locked, unable to move, unable to stop the contractions, aware of what is happening to their body with no ability to influence it. Leprosy occupies a different category, not acutely agonizing in the way tetanus is, but chronically devastating in ways that produced a particular kind of long-term suffering that few other diseases matched. Leprosy, caused by the bacterium Mycobacterium leprae, attacks the peripheral nerves, the skin, and in some forms the upper respiratory tract. One of its most counterintuitive features is that in its advanced form it destroys the sensation of pain in the extremities. This sounds like a relief. It is the opposite. The loss of pain sensation means that a person with advanced leprosy cannot feel when their hands and feet are being damaged. They cannot feel burns, cuts, or pressure. The damage accumulates undetected and untreated. Fingers and toes are not consumed by the disease itself. They are lost through repeated unnoticed injury, infection, and the body's subsequent reabsorption of the damaged tissue. The suffering of leprosy was compounded by its social dimension in a way almost no other disease matched. Before its cause was understood, leprosy was considered a moral affliction as well as a physical one. The visible physical changes it produced, the thickened skin, the lost features, the altered face, resulted in systematic social exclusion. Lepers were required in many societies to announce their presence with a bell. They were excluded from markets, from communities, from ordinary human contact. They lived and died in leper colonies, separated from everyone they had known, while their bodies changed in ways they had no power to prevent. The isolation was its own sustained suffering, layered on top of the physical. Smallpox, at its most severe, the hemorrhagic form, produced a presentation that physicians historically described as among the most distressing they had encountered. The hemorrhagic form caused bleeding into the skin, producing a near-black discoloration across the entire body. The smell associated with the disease was distinctive and deeply unpleasant. The mortality rate of this form approached 100%. Observers described patients in this form of the disease as in a state of continuous agony. But the ordinary form of smallpox, which had a mortality rate of roughly 30% and left most survivors with permanent scarring, produced significant pain throughout the pustule stage. The skin lesions that covered the entire body, including the inside of the mouth, throat, and in some cases the eyes, were painful in ways that patients described as burning, as pressure, as an all-encompassing sensation that left no part of the body untouched. And then there was the disease that stands apart from all of these, not because it produced the most intense single moment of pain, but because of what it did over time, systematically, without mercy, and without any possibility of relief until death. Syphilis, specifically tertiary syphilis, the final stage of the disease if untreated, attacked the bones. Bone pain from syphilitic osteitis was described by physicians across centuries as among the most severe pain the human body could produce. The pain was worse at night. It was not episodic. It was continuous. Weeks became months, became years of unrelenting bone pain, with no treatment available beyond laudanum, a tincture of opium that provided partial, temporary relief at the cost of dependence. Patients in the tertiary stage of syphilis, in the period before penicillin made the disease treatable, lived for years in this state, not dying quickly, not recovering, simply enduring, night after night, a pain that physicians of the era described with a consistency that leaves little room for doubt about its character. The most painful disease before modern medicine was not one disease. It was the condition of being seriously ill in a world where the relief of suffering was not yet considered medicine's primary obligation.